Okay, so in chapter 24, we're going to talk about the nutrition of the newborn. So there is, at the beginning of your chapter, it talks about the different needs of an infant through that first year of life. And it talks about the energy, like the calories they need, carbohydrates, fat, protein, and vitamins. I'm not going to quiz you on specifics or any of those equations in there, but I think it is worth a good read over to understand um, what's how it's required and how they get it, etc. And over here is a picture, as you can see, it's demonstrating the size of the baby's stomach. So when the baby's born, day one, it's the size of a cherry. That doesn't take in a lot of fluids. So really just need a few ounces, a few milliliters. That's why the breastfeeding is the best because colostrum only comes out in a little bit, a small quantity. And that colostrum is thick and filled with nutrients, but comes in the right amount of quality for the baby's stomach. You know, by day three, it's the size of a walnut. By 1 week, it's the size of an apricot, and then it gets to be the size of an egg at about a month. So we don't want to, if it's day 1 or 2 and we're sticking a whole half of a bottle in there, the baby's going to be puking that up because there's just not enough space for it. So that's a good picture. We tend to show that to new parents to kind of demonstrate that as well. And also is, I think, sometimes convincing for a mother to breastfeed when they know that their milk will increase with time, and that is how it accommodates that baby to be a little bit more healthy. The American Academy of Pediatrics and about every other body of medicine recommends that babies are exclusively breastfed, so only on the breast for the first 6 months of life, and that breastfeeding should continue for at least 12 months. 2 years is kind of the American Academy of Pediatrics standard, but in America, we are hoping we try to get as close to 12 months as we can. Complementary foods or supplementing with real baby foods should not start till at least 6 months. And if they're breastfeeding, that can be somewhere between 6 and 9 months. Well, I see parents give their babies foods way too early in life when their digestive system is not ready for it. And it can be dangerous. So really teaching parents to wait at least 6 months. Benefits of breastfeeding are extraordinary. There's a table in your book in 24.1. It has all of them listed, but things like the baby has a better immune system, lower incidence of necrotizing endocarditis. It has lower asthma. IQ is higher in babies that were breastfed later in life. We are finding lower levels of some anxiety, depression, and other mental health things. So it's really good for the mom in that aspect as well. It's calming, it's healthier for you. You burn an extra 500 calories a day. And it is also better for the environment, less bottles, less plastic. It's cheaper and you can bring it anywhere. It travels with you. So it is much more convenient. Uniqueness of breast human milk is that human milk adapts to the environment. So if mom has a cold and she makes immune antibodies for that cold, it's going to be in her breast milk, so the baby's going to get them. And it also, if the baby's sick and needs more nutrients, the mom's body will accommodate for that. So it is a wonderful way to feed and much more safer because of that accommodation. Infant feeding decisions are very personal, and we really try to promote breastfeeding the best we can. But if someone absolutely cannot breastfeed, or for whatever reason, we try not to shame them as well. Lactation in the LGBTQ plus families is very individualized. We tend to use the word human milk other than breast milk in case this is a gay couple trying to breastfeed their baby through donor milk. Also to note if it is a lesbian couple or some kind of combination of two of the parents having actual breasts, that they might share that responsibility. And through pumping and some medical regimens, we can have someone who was not pregnant become a lactating human as well. So just kind of be cautious of the different varieties that you might see in the lactating world. You need to understand how breast milk is ejected. So the breast will make the correct amount of milk. It's supply and demand. So if the baby's feeding more, the breast will make more milk. And that goes the other way too. If you're not feeding and you're supplementing as much, they'll decrease milk supply if you're not pumping. So it's why we tell moms that you can absolutely supplement if you want an extra hour of sleep or something, but you're gonna still want to pump. So that doesn't necessarily mean you will sleep, but or if you're at work, you go back to work and you're not able to breastfeed, but you're pumping just as often as you would breastfeed, so that your body still makes the adequate supply that it needs. So lactogenesis, you have your pectoral muscle, and then you have some sub-Q fat, and then you have all these little lobules in here that produce milk. They're little bunches of milk duct, and then the milk ducts that come out into the areola and the nipple. So you have all these areas that have are producing milk, these little globules right here, the glandular tissue, and then a bunch of fat, and then they go into these main ducts, which then there's multiple little holes on the nipple that the milk is ejected from. Some of you might not know this, but there's the letdown of milk. It's not like a baby starts sucking and the milk just comes out. It's very much a brain thing. So baby starts sucking, you kind of have this message sent to your hypothalamus, which then sends a message to the anterior pituitary, and this is done through oxytocin. And then oxytocin tells your breast those glandular tissue to release the milk. For some women who are tense and stressed and having a hard time breastfeeding, they're not, this whole process is blocked. So it's really important that we try to have women to get that milk released, to relax, to be calm, think of something they love. For women who pump and they don't have that baby that they're looking at that they love that helps produce the oxytocin, we sometimes tell them to put a picture of their baby in their pump so that they can look at that picture, and that helps. So this is very much something that we need to be aware of and help women if they're struggling. So supporting breastfeeding moms is a lot of work in those first couple days, especially if they've never breastfed or they have some issues. Lactation consultants are now on most units, but they're not always readily available. So it does fall on the nursing staff a lot. So initiating breastfeeding, teaching moms how to position the baby, how to get a proper latch, about the milk ejection and letdown, and that you need to feed that baby every 2 to 3 hours. And then feeding should last by a couple days. They're going to last about 15 to 20 minutes on each breast. So you very well could be feeding half hour, 45 minutes each feeding, and then an hour and a half to 2 hours later be doing it again. So it is a job. It is a full-time job to breastfeed, and it can be exhausting. There are some indicators of effective breastfeeding that you really need to look at. That's in box 24.3. What do we know? So women always worry, is my baby getting enough milk? Because I can't measure it and I don't know. And then these are the things that show us that they are, that your breasts are full and then they get softened, like they emptied with milk. Your baby's happy, it's having diapers. There's a list of them, but really take a minute and look that over. And we really try not to give baby any other kind of nipples while the mom and baby are learning to breastfeed. So no supplements, pacifiers, etc., unless absolutely medically necessary. So yes, so that is it for kind of some of the breastfeeding care management. I want to go ahead and show you, this is some pictures of some positioning of the baby. This is kind of the classic down here in C, classic cradle position that women initially want to try, but sometimes they have a C-section. Resting on that belly might be a little painful. So this is what we would call a football hold or a clutch hold, or the baby's body kind of goes under your armpit and you have just feeding on that one side. This is a cross lap mode. This is using either you can use pillows, or those wonderful boppy pillows or whatever they're called now are fantastic to help women support their baby's weight. And then there's the side laying, which tends to be really nice for women who are just utterly exhausted. So there's definitely different ways to position the baby. You need to know what a proper latch looks like. So it's part of your job as a nurse in postpartum to go in there when baby's feeding and kind of take a look and see what it looks like. If the baby's not latched on properly, it can pull and tug at the nipple. It can cause nipple cracking and bleeding and pain, and baby can have a hard time getting any milk out. So we want to see that those lips, I think this is a great picture, are flared outwards, and that they do this kind of pattern of suck, 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 swallow, suck, 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 swallow, and that you can hear that audible swallowing sound. Also important to teach women how to take the baby off the breast. If you just pull the baby off the breast, it's going to pull your nipple. It might cause bleeding and cracking and pain. So you want to insert one finger in the corner of the baby's mouth, like the second picture is showing you, kind of break that suction seal that they have going on, and then take them off the breast. This is a picture of what they call the 10 steps to successful breastfeeding that every hospital has to adopt, and I'll have you read those on your own, but it's basically saying that all of their staff are educated on it, promote it. You're doing skin to skin. You're not giving that baby any type of fluids other than breast milk unless it's medically indicated. You were having them room in, and that you're helping mom recognize those cues, etc., and that you're trying to limit the use of any kind of pacifiers, bottles, etc. So take a look at that. It's important to know. And then, of course, when you're breastfeeding, we really want to help moms navigate things like a sleepy baby, how to wake them up, to breastfeed a fussy baby that's crying so much that you can't even get them latched on. Slow weight gain, jaundice is pretty typical in breastfeed babies because they're not getting as much of quantity. And then what do we do with the late preterm and early term infants? They tend to struggle quite a bit because their brains aren't ready, and that rooting and sucking reflex may not be fully intact, especially the very early preterm. That's a whole nother ball game. They're not going to be put on the breast for a long time, but the late preterm babies, your 36, 37 weekers, might have some issues. Some women have multiples, and you absolutely can breastfeed multiple babies. A lot of women with twins, triplets, etc. can breastfeed, but they end up having to supplement as well, just because it's sheer exhaustion to have to feed so many babies all the time. Expressing and storing milk is important. You've got to teach the moms about that. So you can hand express milk. You can kind of squeeze the milk out just using your hands. A lot of women choose to use pumps. So there's all kinds of different pumps now. There's pumps you can just wear them around, and at pumps you can still use your hands. I wish they had those when I had my babies so I could drive and work and all that stuff. So we've made a lot of advances in this world. Really important you teach women how to store breast milk. On the next slide we'll go over that. And then teaching them how to handle breastfeeding and going back to work, what that looks like. There's laws in place now that any lactating mother does get more breaks so that they can pump. And sometimes they have to kind of fight for their right and their personal place for them to do that. So us nurses can definitely help. Weaning them off breastfeeding, again, we recommend that they go at least 12 months. But we don't recommend that any woman decides not to breastfeed anymore, that they just abruptly stop breastfeeding. It should be, supplementing more with regular foods, we are breastfeeding just a couple times a day and then stopping. So weaning them off slowly. There's milk banking and milk sharing. So I wish this was around when I was breastfeeding too, because I made so much milk. I had total freezers full that I just had to throw away. But now you can donate it, you can bank it. And that helps because our very premature infants, sometimes that's the only nutrition that will save their life. So we're really trying in the NICUs to use banked milk. Milk sharing, you're going to, especially in different cultures, some women co-breastfeed. If they send their baby to a mom who's also lactating while they go to work, and then that mom feeds their baby, etc. We really don't recommend it. There are some risks, especially some diseases and stuff that can be passed, and we don't have a lot of good information on that, but again, it can be life-saving for some women and a very cultural thing, so we have to have an unbiased and understanding attitude about that. Some women have babies together, and one mom makes just a plethora of breast milk, and the other one is struggling, so she'll send some of her pumped milk over to her friend. So you will definitely see instances of this. This is kind of showing a picture of what stored breast milk might look like. They're either in the bottles or usually in these bags, which are really convenient. Stored breast milk has some rules around it. So if it's just you just pumped and it's sitting on your counter at room temperature, it can be sitting there for about 4 hours. After that, it needs to be refrigerated or frozen. If it's in the refrigerator, you can keep it for about 4 days in the refrigerator, and then about 6 months in a freezer, 6 to 12 months, depending on the type of freezer. And then if you thaw it, so you had frozen breast milk and you thaw it, 1 to 2 hours on the countertop, up to a day in the refrigerator, and don't ever refreeze thawed breast milk. If you thaw breast milk, it should be done either just by putting it on the counter or putting it in the refrigerator the day before. It shouldn't ever be microwaved. There are some warming devices that can be used. Room temperature milk to feed your baby is perfectly fine. It does not have to be warmed. And then also when you do thaw it and it gets to liquid form again, shake it up a little bit. So a lot of times the fatty part's on top, and so it's nice to kind of shake that up and make it more consecutive throughout. The nutrition of the mother and the care of the mother who's breastfeeding, their nutrition does increase 500 calories a day, so making sure they know that and they're getting adequate calories, that they're getting rest, that they know how to do breast care. Cleaning the breast with soap and water or just warm water. Breastfeeding and contraception is important, so we try to use the non-hormonal methods if possible, so diaphragms, condoms, Paragard IUD. But if they want to use something with hormones in it, we try to press just progesterone only, so Depo, Mirena, Nexplanon, and those we like to wait to start till about 6 weeks so that breastfeeding is well established. And you can do oral contraceptions and combined hormone methods, but again, we really want to wait till that breastfeeding is well established, so maybe even 8 or 10 weeks out. So we really try to counsel women on progesterone only or non-hormonal options while they're breastfeeding. You can be pressed. A lot of women, as you know, become pregnant pretty soon after having a baby, and you can breastfeed while you're pregnant. There is no contraindications to that. Some women have to have breast surgery. I talked to you guys about me needing to have my mastitis drained, and then how do you keep milk input up? It's very dependent on the situation. You're going to have women who've had breast augmentation surgery or breast cancer or had their breast size decreased. And then it really depends on if the ducts, the milk ducts were severed or not, if the nipple's there or not. There's a lot of different factors to that. Usually when they have augmentation surgery and some other surgery, it can be really difficult to breastfeed. So things we should definitely, counsel women on before they have those surgeries if they plan to have babies. Feeding on obesity can be hard. There are some really large-breasted women that we have had to put their breasts on top of pillows, and then the baby's kind of far away from their arms, so cradling isn't the best position. And sometimes those babies really have to press into their mom's breast, and so we have them put a finger by their nose just so the baby can breathe while they're breastfeeding. But babies' noses, for the most part, are shaped in a way that they allow air to come in and out when they are pressed against the breast. Again, there's some medications that we cannot take while and breastfeed at the same time. If you're going to smoke, do marijuana, drink alcohol, you're going to have to pump and dump for a couple days. We really encourage women not to do those things while they are breastfeeding, and that includes caffeine. And then there's some herbal supplements, etc., that can pose a risk. So really just asking people, what are you taking? And we need to know because we want to make sure it's safe. Some common issues with breastfeeding mom, one is engorgement. So about day 3 or 4, the milk will come in. The woman's breast will become huge and swollen with milk, like painful, like hard as rocks. A lot of times the nipples are exposed or like squirting like squirt guns. It's very disheartening and scary for women, especially if they weren't prepared for it. So we tell them, and it can be too painful to put the baby on because you're so hard and swollen with milk. So we tell women if that's the case to pump a little milk off or hand express some milk off so the breast becomes a little softer so the baby can latch on, and then they can go ahead and feed the baby. And if it's really bad, we'll have them pump a little bit after they feed the baby. And that will get better in a couple days. Your body will figure out how to regulate how much the baby needs, etc. But when that milk initially comes in, it is rough. So sometimes we have them use cabbage leaves to put on their breast when they're engorged and sore. The cabbage leaves have a way of drawing out any extra edematous fluid in the breast to make them a little bit more comfortable. And that's what that picture is showing you. Sore nipples is a sign that maybe that baby's not latching on appropriately. So if someone's complaining of sore, cracked, bleeding nipples, we're probably going to have a conversation about how to get a better latch of that baby, or how to, detach the baby when it's done. Insufficient milk supply. A lot of women complain, I didn't make enough milk, I didn't make enough milk. A lot of times it's you weren't feeding close enough together is the issue. There are rare amounts of women who make not enough milk supply and might have to be supplemented. Plugged ducts, so sometimes you have multiple ducts in your nipple, and sometimes one of those can get plugged and it becomes warm and kind of tender, and maybe even red, and so you want to put some heat on that, some warm compresses on that to try to get that unplugged. We talked a little bit about mastitis already, but mastitis is it's different from a plugged duct, whereas you are get a high fever and flu-like symptoms and you're very sick, and this is an infection, so we definitely have to treat that. And sometimes we use a medicine where you can't breastfeed for a couple days while you're on it. Formula fed babies, we're going to briefly touch on that, just kind of teaching babies how to feed with a bottle. We want them in a either semi-sitting position, a semi-reclined position, or a straight up position, not flat on their backs, not propping a bottle up and leaving them with it, not having them suck on a bottle even though there's nothing in there. They can get a lot of dental caries and some screwed up teeth from bottle mouth. And only milk in the bottle, not later when they get older, apple juice, Mountain Dew, whatever the heck people put in bottles and give to their babies. So really kind of teaching them those things. Teaching them baby feeding cues. Again, it's no different than breastfed babies. When the baby's sleeping and all of a sudden starts moving around, looking around, smacking its lips, rooting, sucking on its hand, that's the time to feed them. Don't wait till they're screaming and crying because they're so hungry. It can be really hard to feed them then. Bottle feeding babies, usually in the first 24 to 48 hours, they're only going to take in 15 to 30 mLs. So I'm not upset when someone feeds their baby and they get 5 or 6, and then they do that again 2 or 3 or 4 hours later. Usually by the second week, though, they're taking in quite a large quantity, so that 90 to 150 mLs per feeding. Or per day, and then they do feed every 3 to 4 hours. So breastfeeding is 2 to 3 hours, bottle feeding is 3 to 4 hours, and we do teach women to wake their babies when it gets to be at the max hours to make sure that they're eating. And in all these cases, really important that you burp your baby. If you don't know how to burp a baby, we'll teach you for sure. In clinical. So infant formulas come in these commercial prepared varieties, like either pre-mixed or in a powder, which you have to mix. So teaching parents how to do that is important, because it seems like common sense for most of us, but it might not be, especially for our young moms. Vitamin and mineral supplementation, that may or may not happen or need to happen, depending on the baby situation. And again, then weaning them off of formula when they're able to take whole milk close to 9 months to a year, etc. And then again, not introducing those complementary solid foods till at least 6 months. So parents have been asked to provide breast milk for their premature infant who is hospitalized. Which of the following is an appropriate part of education a nurse will provide? A premature infant more easily digests breast milk than formula. B, a glass of wine just before pumping helps reduce stress and anxiety. C, the mother should only pump as much as the infant can drink. And D, the mother should pump every 2 to 3 hours, including during the day and night. There's a couple of right answers here. I really want the mom to pump often, every 2 to 3 hours. During the day, and maybe every 3 to 4 hours at night. We're talking a very premature infant who's probably in the NICU, and that mom is either staying at home and coming back to the NICU during the day, or staying in one of the beds there. So definitely every 2 to 3 hours during the day. They may go a little longer at night, but no more than 4 or 5 hours before pumping. And then premature infant will more easily digest breast milk than formula, which is why we want those babies to have breast milk when they get to feeding. And a lot of times very premature infants are gavage fed at the first time they're allowed to get something other than IV fluids. So it is a process depending on the premature level of that infant. All right, and that's it for infant nutrition.